Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man said, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man said, last night, at 7 p.m. on the couch. Whoa TMI, I just need to know approximate time to know if Plan B will work. Me, we have this medication called Plan B. And since the incident happened within 72 hours dash. Man said, oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man said, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me, no sir. There isn't anything you can take now. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay. Not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God Almighty. The report went back, patient provided improper specimen. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Physical therapist, had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15 to 20 cups of coffee daily. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Rural ER doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away. And she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child and her father told her that she could only get pregnant when she's in love. And she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Working midnight in the ER. Family brings in a 4-year-old at 2 am-ish. I ask them what is wrong. They said, ask him, the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? They said, no. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m., purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child, why do you need to see a doctor? Kid, the doctor has suckers. Not a personal experience, but one from a colleague of mine, I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help. Wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks. And told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. "Have you been doing the exercises?" "No." "How often are you doing farm work?" "Every day." "Why haven't you come back since the first appointment 8 weeks ago?" "Too busy with farm work." So to summarize here. You did absolutely nothing that I told you to, and this is somehow my fault. Never saw him again. EMS here. Had a diabetic in his 30-40s who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar is only read as HI, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this 'cause of all the I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged. And it took this man less than 50 paces from the ER door to rip off his bandage covering his 4 and play with the 4 wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection and she said, "Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs." I left that one to the doctor. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and, "I didn't use any drugs." Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside out EMS/fire station. And the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months. Until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full Southern breakfast. She damn near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized. And they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA, the parents did in fact feel justified and hard done by, although as far as I know they didn't express anger at my brother, knowing him. They didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. I'm in the ER. So many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no. Because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the ER before I could discharge her. I worked in cancer research/surgery a couple years ago. There is a good amount of people who will refuse to have a small removal/surgery because they think holistic medicine or praying it away will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. ER nurse with 7 years experience. The list is nearly endless. People with massive burns because they smoked in bed is not as rare as you'd think. But the one that got me the most was a guy who came in for chest pain and fatigue. EKG revealed he was having a really bad heart attack. Activated or cath lab for emergency stents to hopefully save the guy's life. They almost always access the patient through the groin for the procedure, so one of our jobs in the ER is to shave the patient's groin to prep them for cath lab. We get the clippers out, we don't use actual razors anymore, and informed the guy we needed to shave him. He refused. No problem, we will let cath lab do it once he's knocked out. Nope, guy refuses to sign the consent for the stents because he doesn't want his pubes shaved. After trying to educate him, pleading with him, and contacting every goddamn lawyer the hospital has, the guy signed himself out AMA and went home. He would rather die than have his curlies shaved. We looked up his address and we weren't the closest hospital, so if he died at home, medics would take him to a different hospital. Doubt he survived the day. Lady brings her baby into the ER with a rectal temp of 103 Fahrenheit, 39 Celsius. Kid's tacky as hell and looks like shit. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital, and that she recovered medication herself, for epidural, etc. Doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. As a pharmacist, everyone who comes in to buy homeopathic crap, especially for serious things. Once a lady came in with a prescription from the dentist, for some heavy antibiotics and painkillers due to an infection that threatened to damage the jawbone. When I asked if she knew how to take them, she went, "Oh, I'm not gonna take those, they'll go right into the garbage. But I gotta buy them so that my dentist is happy. I'll rather stick with, insert name of homeopathic crap here, instead of poisoning me with some devilish chemicals." Throughout the years I've learned to just shrug and accept those Darwin Award candidates instead of arguing with them. Just infuriates me when I see that they've got children and pets. When I was in the hospital as a patient, there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research. But it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later they relapse and, well, you can figure out the rest of the story. I'm a vet. A few years ago I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, The physical exam was unremarkable, so I asked more questions about the cat's diet. Me, what do you feed the cat? Owner, online trendy raw food brand. Me, how is his appetite? Does he finish what you feed him? Owner, yes, he always eats everything. Me, how much do you feed him? Owner, half a cup. Me, once or twice daily. Owner, once every 3 or 4 days. Me. You only feed your cat twice a week? Owner, I believe in a more natural feeding approach, and based on my research that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wildcats eat 10 to 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. I worked ED for 10 years. Every day people come in and it shocks you how they manage to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had sex with her and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama "you're my sister" shit, we had to educate him that is not how it worked at all. I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt. How it was hurt, how he got there. Nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, no, he is just an idiot. Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he is always this dumb and if she leaves him he would get lost in his own house and starve. Edit, it sounded like his leg was visibly injured or swollen. But when asked what happened or how does it feel, he gave nonsensical idiot answers. Not like slurring but in a regular idiot voice. If feels hurt, I was talking to Jimmy and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Him, something always happens, you know how it goes. I just want my leg fixed. Plenty, although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s. And the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, you know, chemotherapy. Thanks again for watching. I really appreciate your time. I'm posting once or twice a week, so make sure to follow to get notified whenever my next video drops. Also, people may like to read your story, so don't forget to comment if you have one.